certificate is ready, you can pick it anytime. If you registered or if your registration application was dropped off in the region, we shall package whatever came from Kabale and post office. We have a partnership with post office. Post office will transfer everything to the regions where they came from, and the regional officer there will call you to come and pick your registration documents. So basically that's what you need to register, nothing complicated at all. So I hope that one, everybody is comfortable.
Thank you so much, Dr. Bagaya, for that submission. Now, two things I've picked from the comment section here as I was following your submission. Number one, what is the difference between an extract and a practicing license? Then the second item is about how long does it take after fulfillment of those requirements for someone to collect that or to receive that phone call. For now, those are the two things that I've picked from your submission. If we could clarify that at once before we move on to the next question, please.
Now, the law is very clear. It tells the registrar that I'm having issues with my lighting, so when I go blank, don't mind. The law is very clear. It tells you that you cannot practice unless you have a practicing license or you are on the register of authorized practitioners in that particular year. But the law also actually instructs the registrar that he should put your name on the authorized people for that year to practice on the register and gazette it in the Uganda Gazette. Now, we get the entire register of people who have renewed their practicing licenses, and we publish it in what is called the Uganda Gazette. For those who are not familiar with the Uganda Gazette is the only government official publication that contains everything about government. So if you want to anything government has published or what government says as policy, it does not become policy until it is published in that gazette. For you to become a member of parliament, you will win the election. But if your name is not published in the Uganda Gazette, you cannot become a member of parliament because that's not fact. The only factual information for government of Uganda is when it comes from the Uganda Gazette. Now, for you to know that my name exists on the Allied Health Professionals Register to practice in Uganda in 2026, you must appear on that Uganda Gazette, but it's published by UPPC, Uganda Printing and Publishing Corporation. The headquarters are in Entebbe. But it is, if you look at, if I showed you that Uganda Gazette, you would even laugh. One page can have like 1,000 names. So they print very many names on one page because you people are many. We have 56,000 allied health professionals. So you can imagine squeezing them into a booklet. It would be like 1,000 pages. So what they do, they publish very many on a single page. You need, if you are like my age, you need a microscope to see. But to make it easy, we extract your name from that Uganda Gazette and we put it on a plain, a standalone piece of paper, and we authorize it and we give you a copy to confirm that you exist on that Uganda Gazette. So that is what is called an extract. Once you get it, once you're in the Uganda, you are in the Uganda Gazette, and it means that you appear in the authorized practitioners for that year. So legally you are authorized to practice medicine that particular year. Now, let's go to the annual practicing license. Now, Allied is not like the other professional councils. It's a very complicated council. It has very many practitioners who are medical, and not all of them are authorized to practice privately. For instance, you have people with Bachelor of Public Health. They are also allied health professionals people. But you cannot open a private practice and say this is a private practice for a public health officer, because those are not yet authorized to practice. There are only a few of them that are authorized to practice privately. For instance, medical lab, MCOs, dental, and the rest. Now, those ones, once they clock 4 years of experience from the time they graduated and got licensed,
All right, all right, all right.
it becomes complicated because you must have legal obligations to abide by. You might harm people and you don't have the full legal backing to go to court and defend yourself. If you have practicing with an extract, you have a manager, you have a supervisor, so you are working under supervision of someone, and the liability to be sued and the responsibility to answer those consequences go to your supervisor. But if you're practicing alone in your private practice, you need an annual practicing license, which confirms that you have been authorized to practice autonomously, independently. So you need an annual practicing license. Otherwise, you can't open a clinic, you can't open a dental unit, an imaging unit, a laboratory, even when you have clocked the 4 years until you have an annual practicing license. Lastly, an annual practicing license is not only for private practice. If you are working in a government facility and you are responsible for supervising people, you are liable for any professional misconduct which will happen in that unit. You need an annual practicing license. You can be an MCO in charge of a health center 3, but if there is criminal negligence and you go to court, the magistrate or the lawyer will ask you for an annual practicing license. An extract may not save you. So that way, you actually need an annual practicing license. Remember, the extract is mandatory. You must appear on the register. So you have to pay for both the extract and the APL if you want to go into private practice with your independent unit, or you have supervisory responsibility over other medical workers. I hope I made it clear.
Surely, surely. Thank you so much for putting to light some of those issues. Now, colleagues, I want to remind you that the talk shows here at Medical Info That Makes Sense are sponsored by Midland High School of Kawempe. Reach out to the 21st century head teacher to have your kids admitted. But also, this live is an open conversation. Alert me if you have a direct question to Dr. Bernard here, because he has made time to be here with us. I want to bring on Gloria to have the next question. Gloria, over to you.
Yes, thank you very much, Sam, and thank you, Doctor, for being here tonight. I've noticed a few questions in the comments section that I would want to ask before I also ask the next question. As Doctor was talking about the process that the allied health professionals are supposed to go through, the process of licensing, that the allied health professionals are supposed to go through, the process. Yes. One of the questions came up. Someone asked that among all the things that doctor said, he did not talk about anything like a testimonial or anything like verification statement and things like that. So what is the importance of the testimonial or a verification statement in this process? And then number 2, someone asked that if they graduated around 2023 and 2024, is their procedure still the same as the procedure that you explained? Then lastly, what happens if a student does not have, or maybe they misplaced their documents, or their documents have changed names or different names? Because we've seen people that have had misspelled names on their transcripts. So what happens to them? I'm giving it back to you, Doctor.
Let me start with the testimonial. Now, let me tell you, the law talks of official academic documents, which officially means the transcript and the certificate. In fact, in the history of 30 years, in May, Allied Health made 30 years. We've never registered anyone who doesn't have a transcript. It has not happened. But interestingly, we've had a situation over the last 2 to 3 years where we've had people study, graduate, and then they don't have a transcript. And I've received a lot of phone calls and inbox abuses. Why don't you give us our transcript? Now, let me make it clear. Allied is not an examination body. We don't teach people. We don't give them transcripts. That's not our responsibility. That is for Ministry of Education. For us, we are Ministry of Health. So please, it's not our role. Don't hurl insults or frustration on. We can't tell. So it is equally a painful process for us, just as it is painful for you. Now, over the last 2 years, we've been receiving a lot of the young professionals who just came out of school. And they were crying, wailing. Majority of them want to go back to school. There's no university which is going to admit you without an official transcript. But some of them just wanted an opportunity to apply for a job. Now, you cannot apply for a job without Allied Health Professionals Council licenses. So, in fact, the first 1 year we just ignored and said, don't mind. These things sometimes happen, there are delays. This is a new entity, it took over from the burden from UAHEB and UNMEB. Maybe they will sort issues out very quickly. Let's just ignore these people. But we couldn't ignore. So in April, we called a meeting. We actually wrote to UHPAB and we told them, look, we can no longer ignore the cries of these people. We need to register them. But we cannot register them without transcripts. So what do? We need to figure out who passed, who didn't pass. So we agreed on a not so palatable measure, but for the sake of Ugandans who need to be employed and spend money on school fees, they need to work. So we said, okay, the win-win situation is let's create a document which confirms that these people passed and they can therefore be registered. And that's how the testimonial statement arose, because it was a compromise, a win-win situation between UHPAB and Allied. And we agreed that anybody who comes with that testimonial and it is embossed by UHPAB and they give us a register, by the way, before they give you that document, they print a small booklet which contains names of people who graduated and passed. And it is that one on which we run your name on the testimonial and we see whether it appears in that book. If it appears, we go ahead and treat it as though it is an equivalent of a transcript and a certificate. So we are able to process your registration using that document. So that's where the testimonial is. It is something, a stopgap measure which we've just done because of the crisis which is there. But once we solve this problem, we shall go back. We will not register anybody with that testimonial, because now we would expect that UHPAB has started issuing your transcripts. So once the transcripts come, those who will come after that period, you will have to provide a transcript and a certificate. So that's how the testimonial comes in. And I urge you to go and get your testimonials. You come, if you are an affected party, you come and we register you as quickly as possible. Now, let me go to the next question. If I finished in 2018, and I went to China and started bringing in shirts and khakis and shoes, but the business environment is not good. Now I want to go back to medical practice. The law does not say when you should come to register. But the law says that if I find you registering without registration, it is an offense liable to imprisonment and a fine of up to 3 years. and the court may give you a fine of any amount. So it is a crime. So you can finish school and you go and do other things, just don't practice medicine. But the day you wake up and say, I want to go back to medicine, you will come and register like a fresh graduate. So there is no penalty. You just come if you have a degree and I finished 4 years ago, 5 years ago, and I want to register now, you pay 320 and we will register you. If you have a diploma, 300,000. If you have a certificate, it is 250. We register you. There's no penalty at all. The problem is that once you register, we assume that you have entered the realm of medical practice. We expect you to renew every year. Failure to renew, you accrue penalties because it means you've been practicing illegally. So council incurred the cost of looking for you to make sure that you don't practice illegally. So you pay a fine for not renewing the license. I hope I am clear on that one. Now let me go to the next one, the change of names. Now, like I said, the document which guarantees that you studied is your academic document. It is issued by Ministry of Education. We have no business with helping you alter the names. All we can say is that the document you've given us has conflicting names with your national ID. Please, which is which? Go back to the issuing entity and sort out the issue. In this case, you'll have to go back to UHPAB. And UHPAB will issue a new one which has made the corrections. Or you will go back to your university where you studied if you're a degree holder, and the university will sort matters with you. For us, we want you to bring for us a document with the names which tally with your national ID. The gold standard is the national ID. If the names on your transcript don't match the national ID, we will not register you. We will guide you that please go back and correct the names. Whether it is the national ID you need to correct, you go to the registration and the national ID issuing entity and you correct that. If it is the transcript, you go to the entity where you got it, because it has UHPAB on it. So you go to UHPAB and you correct that, then you come back and we will be able to register you. But you can change your names legally. Like you get married to Bagaya, you assume the name Bagaya, and you go to court, you swear I don't know whether it's called what, it's called an affidavit or whatever it is, and it's called, you go to a notary public, somebody who is authorized to witness the change of names and attest that you have actually changed those names. By the way, when you change names also, you will publish in the papers, but you also publish in the Uganda Gazette. So they will charge you money for it. So you publish in the Uganda Gazette, you bring that document to us that I changed the names legally, and we will register you. No problem. So that's in brief, that's what I can say about those three.
All right. Thank you so much, Dr. Bernard. Now, I have a number of people waiting in the queue here. Gloria, before I get back to you, let's first give an opportunity to two people to come in and ask their questions directly, and then we shall come back to you in the bit. Let me have one. Okay, Dr. Atei Dale. Please be brief. Go ahead and ask. Dr. Dale, are you there? We can't hear you. Be brief and ask your question. All right, allow me bring on Musao Julius. Musao Julius, be brief.
All right, thanks, Mr. Sam, for this program. Thanks to Dr. Bagaya for answering all those questions. May I just want to ask, what if someone registered and went back at school for upgrading? He has been at school not working, but he registered. Does the penalty still stand? Thanks.
Thank you so much, Musao Julius, for always making time. Dr. Bagaya?
The penalty still stands in as long as you don't do the following things. For us, we don't reside in your house. So if you go back to school and we don't know that you went back to school, the penalty stands. But if you registered, you practice for 2 years, and on the third year you decide that I am going back to school and the program is very heavy, there's no way I'm going to balance practice and school, so let me go back 100% to school. Then you get a piece of paper, you write a letter addressed to the registrar of Allied Health Professionals Council. You tell him that I have been admitted to pursue MBCHB, see admission letter attached from this year to this year. Therefore, being an intense course, I am applying that you suspend my license for 5 years or 6 years until I finish internship. Thank you very much. Finished. For us, we will receive it and we shall suspend your license. So when you come back and you still want to practice as an allied health professional, then we shall reactivate your license without charging a fee. So you'll just pay for the year and you continue practicing. The moment you don't write, now you are at the mercy of whoever is in office. If you find the bad guy and I woke up on the wrong side of the bed that morning, I will tell you, my friend, when you went to school, you never told us. I will calculate the penalties for all the years and you will have to pay, because by law, you are technically supposed to pay. But if you find that I started off in a morning mass and I look at you and I see the circumstances, you have produced evidence that indeed you have been at school, the registrar has a prerogative to forgive anybody for anything regarding registration and licensing fees. You can even come, we have forgiven people, and the man comes and says, I had a mental illness which lasted 4 years. You bring papers from Butabika and any other mental health facility, very well embossed. I mean, how can I make you pay penalties and this evidence? How can a person who had mental health issues remember that they have, or even practice? They should not be practicing. So why would you charge them penalties? So there are circumstances where the registrar can actually look at your issues in the letter and issue an amnesty and say, this one I have forgiven. So if you're going back to school, please write to the registrar and inform him that you're going to school, and we will waive all the years that you'll be in school. Not everybody who goes to school qualifies for the waiver, because there are those who want the money. They are self-sponsored. They are working during the day, in the evening they go to school. So there you don't qualify. You have to still continue renewing your license because you are practicing. If I find you, even if I gave you a waiver, and I find you practicing, now you cannot tell me that you see I applied for a waiver. No. Me, I know you are in school. You should have a practicing license, because if somebody dies of criminal negligence and they report you to me, you will go to court, and I will also invite you to the disciplinary committee, and you will face disciplinary proceedings against you. Even if you got a waiver, you are not supposed to be practicing when you get a waiver. I hope that is clear.
Thank you so much, Doc. Let me bring on Proud Ugandan to ask his question or her question.
Okay, thank you very much, Doctor, and our host. I really appreciate the information being shared. So my inquiries are three. One, to clarify more on the CPD points, because it's something new to us allied health professionals. Then two, I was inquiring if I'm covering, for example, a facility X, but then I get disagreements with the owner. Maybe they are not corresponding to what we had agreed. What is the official way of me canceling with that person? What's the procedure? Yeah, those are the two questions I had. And maybe to inquire, like currently I'm doing environmental health, but originally I'm a CO. So I'm inquiring, after graduating, do I keep renewing for both, or I have to stick to one?
That's a very good question, proud Ugandan. Thank you so much.
Thank you very much. CPD points. Now, the law, actually, somebody can even take us to court if they wanted. The law requires that before I renew your practicing license, you must have accrued a certain number of CPD points, which actually I think at 20, you should have accrued 20 CPD points in that particular year. So it's a legal requirement, it's not a matter of choice. It's a legal requirement by law. Now, the problem is that CPD points is actually not as simple as you think. It is an extremely challenging task to do. So for 30 years, Allied Health Professions Council has been unable to implement that requirement of law. In fact, it's not only the only one. Even Nurses Council has just started about 6 months ago, 7 months ago. It's a tough thing. You need a lot of infrastructure. You need a database. You need a mechanism to collect the CPD points. You need mechanisms to avoid fraud, because people will come and go buy somebody's signature, just put for me, put 100,000, they get the CPD points. How do you prevent that? Who is going to train? And I think our biggest challenge has been who is going to give the CPD points. There are very many. And for Allied, we have 17 professions, 42 cadres. Now, who is going to train 17 different professionals? And you cannot employ the procedure selectively. You cannot say, the lab people are organized. Now, for them to renew, they will need to get CPD points. But then the environmental people just started degrees and the diploma programs recently. There's no expert to give the CPD points. There's no one who is organized. So if you say, those ones are exempt, the lab people will sue. You are selectively applying the law. It's illegal to apply the law selectively. So if you decide that I'm going to do it at a go, everybody must be charged for those CPD points before they renew their licenses. So, but we feel we have reached a landscape where we are almost ready to implement the law. We are making partnerships with a number of stakeholders led by the professional associations. So I pity you Allied Health Professionals people who don't want to belong to associations. Bubakere Day, you are going to be in trouble, because the technical people when it comes to matters of medical clinical officers is the association. Me, I am a lab person, although I am the registrar. My boss, who is the registrar, is an environmental health officer. So I am not going to say, I think that conference you attended, I think it is okay. It must have given you technical knowledge. I don't know that. I am going to consult the association. If the association says that training which he undertook is not eligible for CPD points, so be it. So if you are not a member of your professional association, please go register, become a member, because majority of the CPD points are going to come from professional associations. We will accredit providers of CPD trainings in conjunction with professional associations, because they are the authority when it comes to technical matters concerning that cadre. We shall also have CPD points coming from elsewhere, not only professional associations and their accredited providers. There are things of soft skills. Professional associations will not give you those. Like if you want to practice in a clinic privately, you need financial literacy. So as a council, we shall accredit people who will provide soft skills, financial literacy, how to manage a business, entrepreneurship, and all those things. We will provide them via providers who are accredited directly, and they will have a percentage of CPD points out of those 20 that you must get from those as well. So we are putting measures in place to collect those CPD points. We have worked with the Ministry of Health, and there is a directive that all health centers of public health facilities that provide trainings and CMEs are accredited, and we are accrediting those. So if you work in a health center 3 and it offers CPD points every Wednesday, CPD trainings, and there is evidence you attend. There is a CPD coordinator. The coordinator documents people who have attended and enters their names in a database which is captured in the Ministry of Health in the servers. We are writing a program, we have our database, and we will be syncing the names on the register with the server in the Ministry of Health. So if you are in a government facility, you must attend there and we will collect those CPD points. But you will also have to get some of those CPD points from professional associations. So we are working on reviewing the guidelines. We are in final stages of completing the new revised guidelines for CPDs. And we shall be rolling them out. We shall engage you in your general assemblies of the associations and offer you training on how to do it and on how we are going to capture the CPD trainings and how to, we shall set up a CPD committee which will be giving us some technical expertise and guidance on how to do it going forward. The target, we've set a very, very stringent target of starting January 2027, although initially we had wished that we will start in October, because we open the license renewals in October usually, before the year ends for the next year. So we had said maybe let's start in October. But the new target which the council has said, let's try our level best to start in January, now is the one which is standing. And we are doing our level best to be ready by that particular time. So please prepare yourselves. Now, let's go to the next question, covering a facility. Now, when you cover a facility, you have a private arrangement with your employer. That person who has employed you to cover his facility is your boss. Allied is not a party to what you negotiate. But there's no contract which doesn't have an exit. So you write a contract and agree. Every contract must have a clause for you to exit that contract. Failure to have it, it actually negates the contract. So you can actually run out of that agreement at any one given time as long as you fulfill the conditions. Now, once you have fallen out of agreement, for us, you just write to us and say, registrar, I've been covering this facility, but effective this date, I am no longer the cover for that facility and I have left. For us, we shall close the facility. The moment we get it, we shall send a delegation there to confirm and tell the man you close the place. If there is no person there, immediately you close the place and you notify us that I have gotten a replacement for the person who left. Then we shall authorize you to open the facility. It takes just a letter. You write a letter, we shall contact the owner of the facility, confirm that indeed you have fallen out of agreement, and we shall take measures to temporarily suspend that license until a replacement is got. If there is no replacement, we close the facility indefinitely. So it is simply that, just a letter like that. But also don't write to us threatening when actually you are the one who is a problem, because we investigate. We will not close the facility without investigating. We will listen to both parties. We call the owner of the facility, either they come in person or we record a statement from them, and we normally don't rush very quickly. We try actually to mediate between you people. Our officers will say, but now you are also being unreasonable. Can't you compromise a little bit? And we try to trade the middle ground. If finally we realize that these people have reached irreconcilable differences, then we close the place. Now, I am environmental health, but I have done MCO. So what do I do? Now, for us, we recognize you to practice a particular cadre. There is what we call additional qualifications. Those ones are qualifications which are in line with your first training. For instance, I have a certificate in environmental health. Now I have added a diploma. When you add a diploma, you come and we upgrade your registration certificate from certificate holder to diploma holder. So you are still in the same line. If you have a degree, because the law, Allied Health Professionals Act, only allows us to register people up in a particular profession up to degree level. So if you attain an additional qualification beyond a degree, the law does not allow us to change your registration certificate to another cadre. We can only recognize that qualification, so we add on your documents that this person is a bachelor's medical laboratory technology. But we also have agreed that now he has a master's in molecular biology and he has a PhD in virology. So we add them as additional qualifications, but your cadre is determined by degree, diploma, certificate. Now, when you change from one cadre to another, you have chosen to change. So you are now environmental health. So you will come and register afresh as a fresh graduate of environmental health science. And we expect you to be practicing environmental health. That is what we expect you to be doing. If you want to practice both here and there, the law is not clear on that one, and I don't think we've done it. But we have people who have gone on to do nursing, a bachelor's in nursing science, but they were clinical officers initially. For us, we retain the registration for clinical officers. So when we come to the field, we find you practicing as a nurse, and as long as you have the registration and the licensure from Nurses Council, we have no problem with it. But we've not registered people on two different cadres as yet, but it's not illegal. So if you decided that, let me get two registrations, I believe it should be possible. But on this one, I will need to consult. Perhaps you get into my inbox and I will get back to you and give you a substantive stand on that. But I don't believe it's illegal because the law expressly does not prevent it from happening. Okay?
Very interesting question there from the Ugandan boy. That was a very good question, Dr. Bernard. I want you to agree with me. Now, I can still confirm that I have a number of people in the queue that want to interact with you directly, and I hope we accord them that opportunity. But before I do that, I want to bring on my colleague, Gloria. Gloria, you have been quiet for quite long. Kindly unmute and let's carry on.
Yes, guys, thank you for being around for this live. Before we get on to, I don't know this name, I can't even see the name. I will have to ask Dr. Bernard something that has been burning in the comments section. People have been saying, why would they renew their license each year? Why would they renew their license each year? The APL and the extract each year, mostly the allied health professionals, yet the nurses take 3 years. And do they have to have those extracts each year since it is almost the same thing? Do they have to have them each year? And the other thing is, since they need to get these CPD points, Doctor, I would want you to clarify, is the number 20 CPD points or 50? Because some are confused. If they have to get all these CPD points, don't you think that this time is just very small, just 1 year, and they have to get all those CPD points? Yet the nurses are being given close to 3 years to get the CPD points so that they can renew their licenses. Go ahead, Doctor, and then I will bring on I don't know to ask his question.
Okay, so let me start off first of all. Why do we renew every year? You renew every year because that is the law. The law says your license will only, I didn't get my license here, I left it in the car. I mean my act. You know, when you come to register with us, the package we give you has that yellow book. That yellow book is the law which we follow. Everything Allied is doing, it is that parliamentary law. It is a law. It says the license will last up to the 31st of December of that calendar year, period. From 31st, it has fallen out of it has expired. You have to get another one. Even if you renew it on 28th December, on 31st December, that extract will expire because the law, it is mentioned in the law. It's there. So it's not me who is making up things to make money from you. The parliamentarians in 1996 who were there at that time determined that that is what the law should do. But let me tell you the spirit behind that. If you don't renew that license for 3 years, Ministry of Health has a mandate to know where every healthcare worker is. When I'm giving statistics in senior management and top management of Ministry of Health, every quarter, I even update them on how many allied health professionals are there. Now, if you don't renew every year, I will give statistics of people who died, people who are not, I don't know if whether you just died or you didn't renew. So we plan for the country. That's how we know that we don't have enough allied health professionals. So let's continue keeping this program running. For instance, I can tell you for sure, and I know you are MCOs here, there was even a suggestion that why are we training more MCOs? We should stop. Now we are producing very many doctors. But guess what? You're producing MCOs and doctors, but they are going out of the country. Who is filling up that space? His MCOs. How are we able to know that we don't have enough doctors, so we continue training MCOs? It's because we keep reporting on those statistics. So failure to report accurate data leads to inaccurate reporting and therefore inaccurate planning. So National Planning Authority, if you go in National Planning Authority and you look at the statistics, status quo for healthcare workers, all those things are in red. Radiographers, sonographers, even medical clinic officers, they are all in red. We still need to train more. That comes from the renewal of the licenses. We get who has renewed, who has not renewed, and we report statistics and we say the ones who are renewed are the true reflection of what we have. But we know that a certain percentage doesn't renew. So we even tell ministry that, but although the ones who have renewed are 36,000, we estimate another 29% who have not renewed and they are absconding. We will find them. So we give those statistics and they go on to plan accordingly. Let me give you the good news or the bad news. I don't know whether it's good or bad news. The bad news is that the Uganda Nurses and Midwives Council Act and the Allied Health Professionals Act, both of them have been highlighted by government to expedite the process of their review because they are 30 years old. Guess what in the proposals? Nurses Council has proposed to come to 1 year. So they are going to come to 1 year. So because they realize that this thing is not tenable, somebody disappears from you, you don't know whether they are practicing or not for 3 years. You don't know where they are. It's a conundrum. So they are also proposing that let's go to 1 year. So they are going to come to 1 year. Now, the other question was, I don't remember. Gloria, can you remind me? I didn't record the second one. I hope I have answered that one correctly. The second was, Gloria, are you there?
Yes, Doctor, I think you've answered
Yes.
the one about the APL and extract and should we renew them each year. Now, my
Yes.
other question is if someone has not been working, but then they registered for their annual practicing license, but they've not been working for years, are they also supposed to be paying their APL and extract when they are not working? And then the other thing, you talked about the accredited CPD providers. Should they be charging people for their services that they offer? Yes, go ahead, Doctor.
Let me start with you have registered practice for 2 years, then you sort of you're like, I'm not going to work. If maybe if you're female, you got married, you decided to take off time to just raise your family. Now the last child is about
No, Doctor,
6 years.
Doctor, let me interject somehow. They are not
Sure.
leaving work because they don't want to, but maybe because they have failed to get the employment. That is what I mean.
Oh, okay. So you have registered, hoping that I'm going to use this registration certificate and extract to apply for jobs and get. Unfortunately, I am unable to get employment. So I have not worked for the last 6 years because I couldn't find work. Now, should I continue renewing? The answer the correct answer is yes. Because there is no job by law which should even be interviewing you if you apply and you don't have a license. They will be breaking the law. Actually, in the law, Allied is very generous. In our law, it is the only law which says that if you employ anybody who is not licensed, you will be arrested. We are supposed to arrest your employer for giving you a job when you are not registered or when you have not renewed your license. It's in the law, it's in the act. But have you ever had us arresting someone for employing you? Normally, if we go very far, we will arrest you maybe, but we don't arrest the person employing you. But under the law, we are supposed to arrest them. So if you are going to interview and apply for any job, it means you must maintain the license. Or if you do not maintain the registration, if you don't maintain the extract, it means that when you see the job advert, it has 30 days. Usually they have 30 days notice. It means that within those 30 days, you must run very quickly and you renew your extract. But now you will face the penalties because for us, we will not know that you are not working, you didn't have a job. Nobody is going to follow you up to know whether you are working or not. So when you come and say, but I was not working, you see, we will say, oh, sorry, but now there is no evidence because it is difficult to prove that you are not working. But ideally, if you are not working, you should come and renew the license so that you are able to apply for that job. So it will cost you more money because each year you don't renew, there will be a 50% surcharge. But good enough is that we don't charge a lot of money. So 70,000. So if you add the 50% penalty is 35,000. So you pay 105 for 1 year that you missed. Or if you miss 2 years, that will become 210. But if you miss very many years, the costs can accumulate. It can actually add up significantly. But thank God that I hope people don't take more than that to get employment. Okay, so that is for those who are not working. So I see people are wondering how many CPD points. The CPD points are in the law. You people, you read that thing, that small yellow book. It has everything that you are asking me here. But when we give it to you, maybe you don't know why we give it to you. Because
Doctor,
when we come to yeah.
It is one thing that I've noted here. In fact,
Yes.
I feel like our conversation is drifting away from the topic of discussion tonight, as we are heading into a lot of CPD points and the law. So I want to request people that are following us that to have these two at a pause. Doctor, kindly confirm if we can have sessions where we go through CPD points as CPD points and the law as the law, because we cannot exhaust everything tonight.
We have a legal unit, a legal department. We can actually organize sessions where we can just talk about the law. We go through that book section by section, and people get to know what those things mean. And we can organize sessions for CPDs alone. And I want also to tell you that we are going to be having monthly interactions with the registrar on the official Allied Health Professions Council TikTok account, which happens every last Thursday of the month. And we will be communicating the theme. I think on Monday, that theme will start to be publicized. So we shall also be addressing these things, and we shall also be interacting with you. As long as you notify us in time, we are happy to interact with professionals on platform. It becomes very powerful tool for us to have meaningful regulation.
All right. Thank you so much, Doctor. Now, I want Gloria for us to move back to the topic of tonight's conversation. as I have observed some comments coming through there, where Problem Child was saying that, Gloria, thank you so much. Okolera Bantu. I think he was appreciating the questions that you directed to Dr. Bernard there. Let us have, I don't know. That's the handle, I don't know. Unmute and have your questions asked. Then we shall have a Problem Child. Kindly be brief as we wind up here.
Okay, thank you, Gloria, Doctor, and Kibbs. My questions, like you have just shot me cut. Like the other thing was about CPD points. I won't ask about it, but my query is, you had already registered, maybe, for example, registered in 2024, then 2025, but along the way you were practicing, hoping to get job, you didn't get. Then along the way again, you went back to school to upper grade now, doing MCB or any other bachelor related course. But then, if you think that continuing renewing license seems to be costly a little bit because you are not working at the same time. Every break of a semester, you just go home. How do you handle that thing? I just ask for clarification. Thank you, Doctor.
So if you go back to school and you communicate and suspend the license, all those years you are in school, you will not be charged. So when you come with your transcript and evidence that you have been in school, we shall look at when did school start and when has it ended, and we will waive those years. But if there is a year where you didn't renew before you went back to school, we will charge you for that year. I hope I'm clear on that one.
Yeah, before I go back to school, I must write to council.
Yes, you must write a letter addressed to the registrar, Allied Health Professions Council, that have been admitted for MBCHB. It is starting in August and it will end 5 years from now. I promise I'm not going to be practicing. I'm purely going to be in school. So please suspend my license. We will suspend it.
All right, let's have a Problem Child.
Thank you so much, the organizers. Now, normally when you're practicing, you tend to focus more on the direction you're taking as a professional. I work as a paramedic where I do work, and we do several drills weekly as a mandate, and a lot of CMEs which earn us CPD points and certificates within the company. So it means that it might not benefit me to attend a CPD awarding session about, let's say, PPH, because the cases I meet on a daily are cardiac arrest, such cases. And it means whichever knowledge I need to add in that particular year has to focus on what I do on a daily basis, because I may never meet a patient of PPH in my career. So since we do these drills and we have evidence of certificates, for example, where I work, it's an international company. They offer us certificates on a monthly basis. We're supposed to do a certain CME online and we earn a certificate, and drills that are weekly. Can't those also be considered? Because honestly, most of these awarding bodies are going to bring cases of acute water diarrhea. Where I work in the whole year, I never see a case of water diarrhea. So I need some clarification whether the certificates I get on a monthly basis and the drills I do at my workplace can award me CPD points so that I don't have to hassle with malaria cases, PPH, that are being brought up in sessions that are done online by other awarding bodies. Thank you.
You see how the CPD points are determined is a matter of regulation. When you develop regulations, what did they say? And that's what I just said, that we are in the final stages of reviewing the new guidelines for CPDs. And we have considered a lot of things in there. I don't want to preempt them because it's still a draft. A lot of things are changing. But like I told you, I came from academia. I was teaching in Makerere University for 14 years. Now, one of the things that doesn't make sense, I am a practicing professional, but I'm also in school. I am an MCO, but I'm doing MBCHB. In the weekend, I go and cover a clinic to get some money for tuition. Now you come, you have done a full course, 4 credit units on management of malaria. Clearly, if the focus of the CPD trainings was malaria for clinical officers in that year, why would I make you go and attend an association CPD session when you have done a 4 credit unit course for your degree that you are pursuing? It just doesn't make sense. So some of the contributions, like I told you, majority of the CPD points are going to come from providers as accredited by jointly between the council and the association. The current proposal, I can maybe preempt that one, is 50%. So 50% of the CPD points will be from technical courses which are approved by your association. The other 50% is going to come from multiple sources. You will have 25% of the CPD points coming directly from the council. That is for soft skills. You have to learn safety, IPC. You are a healthcare worker, you should know about IPC. You should learn about entrepreneurship. You should learn about ethics, professionalism. There's no professional council, there's no professional association that has a monopoly on that. So that is going to be coordinated centrally. But then the other 25% will come from other sources. I have written a manuscript. It has been published in a high impact journal about HIV and drug resistance. Surely, why should a professional association not recognize that? Or why shouldn't council recognize that as a contributor to my CPD points? We are putting all these things in the guidelines to see if somebody publishes a paper and it is peer reviewed, how much should a paper contribute to the CPD points? The guidelines are going, how do we calculate that and things like that? We are writing guidelines to help us solve those issues. So if you are doing your work and it is in it's a paramedic and you're responding to cardiac arrest and you're a clinical officer, clearly this should be contributing to your CPD points, but we will refer you back to your professional association as the technical arm to tell us whether that training actually is in line with your professional practice and how much CPD points should we award. The CPD points calculation is going to be sorted very easily. So it keeps on coming back, but we'll get a time and come back and address that issue quite extensively.
All right. Thank you so much, Dr. Bernard. Now I request that for the rest of the people in the queue here, you give them a pinpointed response. Let me bring on Dr. Leonard. Unmute and have your question asked.
Thank you very much. Keep some. Kind of late to the discussion, but at least I've gotten something, and there's a reason why I wanted to come and attend this live today. My question actually is more concerned about this thing called so-called CPD. Yeah, I've just got registered of recent, just 2 weeks ago. But still, when I try to read through the books that were given to me from the Allies, especially the CPD book, there's one thing I wanted to understand, that because they have given for us example of how to fill the book about it. So, like, my question here is that if at my facility, I'm the one, maybe I'm the main person who always chair for maybe the continuous professional development, maybe something like CME. I'm the one chairing for that. Then am I allowed to sign for myself, or someone else can also sign for me among the people who attended the CME? Is my question. I would like to get more about that. Yeah, thank you very much.
Dr. Bernard, can we have all of these questions and then you can respond at once?
Sure.
Gloria, over to you, please. Gloria, are you there? Yeah, I can get you now.
I'm going to give the microphone to Don. What is his name again? Don something. Please, if you're Don something, unmute and ask your question. In a few, please. We are running out of time.
Yes, good evening, guys. My question is, I missed registration on 15th, but I have the verification statement, which they told me after 15th it expire. So will I be able to register with it, or I wait until the transport is out?
Yes, thank you very much, Don. Thank you very much, Don. We're going to, I think Doctor is taking note of all these questions so that he can answer them at once. We're getting to Prince. Prince, if you're Prince, please unmute and go ahead.
Thank you, Gloria. Like for me, I'm a student. I've just completed my CPH last semester, and right now we have not yet received any as of the recommendation or anything as a testimonial. We're just home, literally home. So I wanted to ask, how do I go about it? If at all I wanted to work, if at all I wanted to be practicing, and then the second question I wanted to ask, will I be able to upgrade? If I wanted to upgrade in casting tech. Then lastly, and the most biggest question that is going around is, there are some universities in India which are providing us chances of skipping diploma, as in they're saying if you did CPH, then you also did S4, it means you are able to skip diploma. So and they are offering bachelors. So if we come back in Uganda and like if you want to work in Uganda back, does it have any effect with our future? Thank you, Doctor.
All right. I think let's get to Mani. Please unmute and ask your question.
Thank you so much. The name is Manragava Nicholas. So sorry for coming here late. Maybe the doctor might have tackled the question, but I'm just inquiring in case you finished school maybe 2023 and you delayed to register. Do you also take up the penalty charges because of late registration? Thank you.
All right, thank you. Let's go ahead with Dr. Ekorin. Dr. Ekorin, unmute and ask your question.
Yeah, thanks everyone for coming. I also thank the doctor for attending. So my question is, last week I went to your pub and got the verification statement. Then they told me to certify it. I certified it. I took it to the council on Monday. Then they asked me everything that is required. I gave it to them. Then they told me to go and pay. I paid 300, then 3,000. Then they were entering my things in a system. They told me they are not seeing my name on the computer. Then that also I'm not yet in the list of the of those names from your pub. They told me next day they are bringing another list. That was Monday. So now they told me to leave the phone number and email. They also gave me their phone numbers. But up to now they have not yet called me yet. They told me Tuesday they will be bringing other names. So how often, the question is, how often do they bring those names from UHPub? Thank you.
All right, thank you. Let's go ahead with Minister so-and-so. I don't know. Unmute and ask your question.
Thank you for the opportunity. My question goes like this. Last year, I happened to register a facility whereby I followed all the procedures which were recommended, and I did. On following up with the registration, They checked. The only thing that verifies that I submitted the papers of registration, it's the registration book at the reception. But they tried following up with the papers. There's nothing. So we kept on following up until now. The regional head has not started dodging us. So I don't know how can I get help, because I already paid, whereby I engage the DLFP of the district, and DLFP telling me I go and sit at the allied office until they produce. Otherwise, they transfer back the money. So my question is, how can I get help? Thank you.
All right. Thank you very much, Minister of I don't know. As we call Dr. Bernard, I would want Dr. Bernard to also add this question because it was in the comment section. The professional was asking, he is a diploma holder, but he's asking if he can open up a personal lab and practice privately. And then also, can a diploma holder of laboratory technology operate a clinic? Yeah, go ahead, doctor.
Okay, thank you very much. There are 1 gazillion questions, but I'll try to answer them. Let me start with minister, because this is very critical, because all those licenses are signed personally by me. I don't know who assessed the facility. You see, our process is a hybrid of local government and also directly with the Allied Health Professions Council. So where there is a regional office, our regional supervisors actually efficiently can go to any place and assess any new applicant for a health unit and submit the application immediately. But the regional supervisor, we are not in all districts. We are only in 12 districts, 14 now. So which means that each regional supervisor is supervising about 10 to 12 districts. So driving, for instance, we have a regional office in Masaka, and Masaka is also responsible for Mubende. So he cannot drive there, it will not be cost effective. So what happens is that you approach the local government, which is the office of the DHO. There is always an assistant DHO, or usually called a district health inspector. They normally work as our district allied health supervisor, so they do the assessment. So I don't know where the challenge is, but if the assessment was done by the district local staff, you let me know. You go in my inbox. I hope you can go in my inbox and just put in the particulars of the town and the district where you are. For me, I will determine the regional supervisor, and you put in the name of the professional who is attempting to open the facility and the name of the facility. You send them to me in my inbox. I will task the regional supervisor to actually go and follow up that application. But if you go into the regional office and you found that the name of the health unit is captured in our regional register, it means that it is in our system. I will follow up at head office, because those ones come to head office and they will pass my desk, because I personally signed those licenses. That license could be lying in the registry. It came out and is lying in the registry. Inbox me the name of the facility and the supervisor, the person covering the facility. It will make it very easy for me to actually get it for you on Monday. I'll tell you whether it is in the registry. If it's not there, I will liaise with the regional supervisor to make sure that we solve that problem. Since going there, I have lowered that period. Once the license, you people should know that once your application arrives at Secretariat, we have exactly 10 days to have that license out. And now the delay which you are trying to solve is to transport it back to the region, because now we hand it over to post office. And you know, post office, sometimes it will be, there are times when you hand it today and in 4 days it arrives. There are times when you hand it in and it takes another month. So post office is still doing a disservice to us there. But we know that this is a business. That license is needed as quickly as possible. So I will try to solve that problem for you. Personally, I commit to that. Now, let me go to the first question. So I've answered that one. The first question is, at the health unit, maybe you are the in charge of a health center 3, so the CPD is in your hands. who signs for me, yet I am ascending the facility CPD sessions. You have a CPD coordinator at that facility. If you are the CPD coordinator, the facility in charge will sign for you. If you are both, you are the CPD coordinator, but you also the facility in charge. You have a supervisor. That supervisor is at the district. You go there and they sign for you with evidence that you attended these sessions. And the problem will be solved and you'll be entered in the database and we shall acknowledge those CPD points. That is one. Number two, verification statements expired. It is true. Every verification statement which is being printed by UHPAB has exactly 2 months to expire. They decided to do that because they didn't want crafty people duplicating that document, and you can imagine the travesty which can happen if Allied registered a person who actually never went to school. It can be quite a disaster. So because of the gravity of the matter, they decided that let it be expired. Somebody has to come and register as quickly as possible. Unfortunately, I don't want to blame a sister agency, but I think the communication was not the publicizing those documents that they have started printing. Those documents did not come in timely. So those which were printed first, by the time people knew that all our statements are there, already 1 month had passed. Now you have to look for money to first of all transport yourself to pick it, and then you have to get money for registration. So some people unfortunately had those documents expire on them. We have engaged with UHPAB to figure out what happens with these expired documents. I don't have the answer right now because we have written to request them to clarify what happens, and we have actually written asking for them to set up a meeting. We go and talk and iron out some corrective measures on what should be done. So for now, I don't have an answer. So that's where it stands for now, because the document is expired. We cannot use it to register you when it is expired. Otherwise, IGG will come for me. But we will communicate. Usually when we agree with UHPAB, we put it on our social media handles and website, and we also expect UHPAB to do the same. But we've noticed that they're a little bit lax in the way they communicate. They are not as aggressive as Allied has become. Okay? The next question is, I just completed. How do I go about practicing if I have not yet registered because I'm waiting for results or my transcript? Now, for us, we consider anybody who is waiting for results to be a student. And when you are a student, you can only practice if you are on internship. So you can ask a health facility which has a senior person who is registered, you work under them. But for me, if I find you in a facility practicing alone, no supervision, that is called a quack, and I will arrest you for it. So please, you can practice under supervision of someone who already has the qualifications and the registrations. Don't be tempted to work alone. Please work under supervision until your transcript comes out. I know that case in Mukono where somebody was found practicing and still didn't have the results. It is the same case. He was supposed to be working under supervision, not alone. Okay, how do I go back to school if my transcript has not come out? Now, there's no choice. I don't work for any training institution, but I can tell you there's no training institution which will admit you for any program if you don't have a transcript yet. So you people keep making noise so that UHPAB can listen to you and expedite the process. We are doing our part as a co-regulator and a sister organization, but please you also help us to make sure that you advocate for yourselves as well. And then there's the issue of India. In India, you can skip a diploma and you can actually jump from a certificate and go to do a bachelor's degree. Now, let me tell you, in academia, there are circumstances when that can be allowed. You have to meet those circumstances. If you don't meet those circumstances and somehow you go to a crafty university and it doesn't follow the circumstances for you to skip the diploma, you'll be in trouble. For instance, in Uganda, you can only skip a diploma on two accounts. The first one, you must clock 25 years. You go to a National Council accredited institute and do what is called a mature age entry exam. If you pass that mature age entry exam, which is actually an aptitude exam, then you can use that certificate to go and obtain admission into a university. From certificate, you go to degree straight. But the condition is that you must be 25 years old. So that is the problem. So if you do that mature age entry and you are not 25 years and you get in, the degree will be cancelled. You have to be 25 years or older. The second one is that you can access it through what is called a higher education access certificate, which is actually done for about 9 months. It's supposed to be 1 year. You train for 1 year. It's sort of like a bridging program. If you pass it, then you use that certificate to enter for bachelor's. A higher education access program is much more open. It can be done by anyone who wants to go back to school as long as they pass it. So those are the only two circumstances you can skip. So you can go to India, but India must have equivalent pathways to what I have just said. If you are skipping without those pathways, believe me, you are going to have problems in the future. So make sure that you fulfill those requirements. So Maniragava says they finished school several years ago. I think I answered that one already on whether if you delay to come for registration, where there are penalties. No, there are no penalties. You just come and say, I finished school, but now I had rested for some time planting matoke. Now I have set up a farm, I'm ready to practice medicine. You come and we register you, no penalties. Echoing, UHPAB certificate, you paid, but then after paying, then they said your name is not on the list. Now they said they would call you because on Tuesday there was a new list coming. It is true we have found these challenges. Now let me tell you, there's almost 3 years now, 3 cohorts of people who have done exams and even graduated, and UHPAB has not released the transcripts. Every year, our estimate from all allied health training institutions is that the total which comes out is approximately 3,300. You hear that number? 3,300 people graduate from the 42 different cadres and trainings, curriculums which we run as allied health. Out of that, about 50% of them are expected to register. The other 50% delays, but eventually some of them come. But for us, we estimate about 50 to 60%. So that would make it about 1,800 people every year that we are supposed to register. So times the 3 years, we are talking about close to 5,500 people. Now, UHPAB, we agreed that they're supposed to give us a list of 5,000 people plus. But it is not easy to generate them because some of you, they have to go back and look, did they pass? Does this one have a retake? Is it a retake? Because remember, they inherited people from UAHEB, and now they have to merge the databases with the nurses. That merger takes time. So what has been happening is that they send us a list of about 1,200. And then we have them. So when you come with that document, we first look for your name in that book which they have given us. If you are not there, we cannot guarantee that that document is not a fake. Because people come from Nkrumah. By the way, you should see how many fake transcripts we intercept at registration. So many. Every year we get approximately 2,000 fake documents. So we are very, very careful because we know the repercussions of registering somebody who never went to school. So if you don't, the only way we can prove that that testimonial is actually correct is if you appear in the book also. So if you are not there, we cannot proceed. So we write to UHPAB with a list of people who came and they are not in the book they gave us. Then they put you in the next one and they send another 800. So then we check there. If you exist, we call you and say, hey, we saw your name, please come and pick your registration license. So because the process is a bit slower than it should be going, we've met a few cases which are like that, where you get a person come with a testimonial, but then they are not in the book. So maybe they are still compiling the next set of names to send to us. But we are working on that. I tell you, once your name appears, we will call you. Or you keep calling us maybe after every 4 to 5 days. You call and ask so that we don't forget about you. But we are trying our level best. By the way, the registration process is very efficient. Now we are registering you and it is taking an average of 5 days. You get your registration certificate and your first extract. So if you have no issues, 5 days, you get your documents. Next is diploma lab. Can I open a private lab? The answer is yes, even if you have a certificate. You can set up a private lab. The only problem is that labs are opened in levels. They are not like clinics. When we have three levels of labs. We have level 1, level 2, level 3. Level 3 is the most complicated one. Level 1 is the simplest. So if you have a certificate, you can open a private level 1 laboratory. But you cannot open a level 2. You cannot open level 3 because the scope of work there is a bit complicated for you and it's not covered in your curriculum. Likewise, if you have a diploma, you cannot open a level 3 lab because in a level 3 lab, there are tests and equipment which are not on the curriculum for diploma person. So there are things which will be complicated for you. So, but if you have a diploma, you can open a level 1 lab and you can open a level 2 laboratory. Now, level 3 lab is for degree people going upwards. I hope that one I have answered and it's clear. Now, if I have qualifications in lab, can I open a clinic? Anybody can open a clinic. Even your father, even your farmer can open a clinic as long as they are not the ones practicing there. Basajja Balaba has a whole hospital and a medical school and is not a medical person. You just need to have your money to set up the infrastructure according to standards, hire qualified people. But if you are a lab person and I find you practicing medicine like a clinician, I will arrest you. It is called practicing outside scope. And it is a crime for you to do it. If you are a clinical officer and I find you extracting teeth, it is also called practicing outside scope. I will arrest you for it. If you are a dentist and I find you taking images, you are practicing as a radiographer, I will arrest you still. It is practicing outside scope because it is dangerous. It is extremely dangerous for you to study. By the way, when you are studying, we all study a little bit of something. You are in lab, you actually study some clinical work, some medicine, drug resistance, doses, you do pharmacology with the people. But that doesn't make you a clinician because there is more to clinical work than just knowing those prescriptions and doses. Those people clerk patients. They do clinical diagnosis. We are not taught as a lab person, me I'm a lab person, I am not taught how to diagnose clinically. Because by the time a clinician makes a lab request, they have already a clinical suspicion and they just want to increase the index You are not trained that. So how are you going to open a clinic and practice? You become a danger to community, and my job is to protect the community, the public, before I can protect you. I hope I'm very clear on that. Never practice outside your scope. It will throw you in problems. It is
Doctor,
worse if somebody dies under your jurisdiction. You will be in trouble.
Dr.
Okay?
Hassan here has
Thank
said
you. I
in
think I've answered all the questions.
Doctor, can you hear me?
Yes.
Hassan here has said in the comment section that you are speaking late, Doctor, about scope
I'm
of
speaking late.
yes, about scope of practice.
Yes.
That they are already doing it.
You know, you cannot eliminate crime. Even police arrest people who rob people, but they are never finished. But a thief has 40 days, and your 40 days will end one day. You will get arrested, and you will not like it. Because, and the charges are many. Because you'll be arrested for practicing outside scope, you'll be arrested for pretending to be somebody who you are not, you'll be charged with endangering the life of another person, and if the person actually has damage, has harm, they will also charge you with attempted murder. You can be charged with 10 offenses just for that. You can do it, but luck will run out one day.
All right. Thank you so much, Dr. Bernard. Now, some of the comments coming from you. People have been very active, Doctor, in the comment section. Number of thoughts flying in there. Just quote a few of which Josh said that you need to teach us everything about CPD. And I think Doctor confirmed that he will arrange. We shall make time so that he comes back here with the CPD team to talk about CPD at length. Then problem child here said that they should consider this session as a CPD session so that they get CPD points for it. However, CPD points I think are starting next year. So problem child, I think your claim would be very right, but it's not yet valid. Doctor, these talk shows happen every single Friday from 9 to 10:30. We use about 1 hour and a half, but because of the questions that people had, we have stretched it to over 30 minutes. And I want to assure you that I still have a couple of people in the queue here who want to interact with you, but we cannot go past this time. We understand that you have been talking to us for the past about 2 hours. It is really a long time. Colleagues agree with me that we cannot exhaust everything in a single.
Before you close,
yes.
Let me just give people the following numbers, contacts.
Right.
Because those who have licenses and they are stuck in the system and you need to follow up, you will call me, but I'm always in meetings. I actually annoy people a lot because they call and I don't pick. And sometimes you send a WhatsApp and I respond the following day. But please, if you have a pen, record the following numbers. They will go straight to our reception. And our reception is manned by 3 people. So I expect them to pick. If they don't pick, go in my inbox, because managing those people is also my responsibility. We will be as efficient as possible. We operate as a business and we cannot afford not to pick phone calls. Okay?
All
so
right.
if you have a pen, please write. Airtel line is 0706 34 56 88. Let me read it one more time. 0706 34 56 88. So that is our Airtel line. It goes direct on our front desk. MTN is 0393 24 27 36. I will read it one more time. 0393 24 27 36.
All right. Thank you so much, Dr. Bernard, for sharing. Now, as we come to the closure of this session, allow me thank all of you that have kept around this live for all this time. Hoping 2 hours is not very little time. Thank you so much all for making time. Allow me bring on my colleague Gloria to have her parting shots before I finally invite Dr. Bernard to have his closing remarks. Doc, as you come to have your closing remarks, 2 questions for you. Number 1, if someone is tired of being an allied health professional, what should they do to cancel everything? Then the second question is, someone in the comment section here put it like, what does it take for someone to work in Allied Health Professionals Council? From me, colleagues, I would like to thank you for keeping around for all this time, and also remind you of my sponsor, who is Midland High School, Kawempe. That is a secondary school from senior 1 to senior 6. Reach out to the 21st century head teacher, Mr. Kateleka Mark, and he will happily admit you. We are also sponsored by M-Care Pharmacy. It's an online shopping center for all your medical needs. Go and Google them out so that you can have all your pharmacy needs filled. Gloria, allow me bring you on as you have your parting shots for this particular session. Over to you, Gloria.
Yes, thank you very much, Sam. And I think he has exhausted all our sponsors tonight. Thank you guys for being around on this live. We don't take it for granted, and we hope we give you all the information that you need to get. And like we agreed, Doctor will keep having time to take with us so that we keep learning more, and he's getting used to the Gen Z thing. So you stay with us every Friday at exactly 9 p.m. on the Medical Professionals Roundtable. So guys, as we conclude this live, I want us to listen from Dr. Bernard as he answers Sam's question. I would also want him to talk to the people that are frustrated about this registration thing. What do you have to tell these people that graduated in 2023? I know it is for UHPAB to talk more about it, but if it were you, what do you have to tell them? What would you advise them to do as we wind up this session? I give it back to you, Doctor.
All right. Thank you, Gloria. I think before Doctor comes in, let me also remind the people following this live to go ahead and follow me, follow Gloria, my co-host there, and also go ahead and follow Dr. Bernard S. Bagaya there for you. Thank you so much. Over to you, Doctor.
Sam, and Gloria, I want to thank you first of all for being active. I mean, you're doing something which is not, this should be for a journalist or somebody with mass com. But the fact that you're venturing into this space, we will eventually get comfortable talking. I don't like journalists because they always quote me outside context. But if I'm working with the context. But if I'm working with there are very many people you could have invited. I am just a deputy registrar. It's not a big position at all. So there are more important people perhaps. So thank you very much. I want to thank my colleagues, the professionals who have taken off time to actually come and attend this session. I know you could have been sleeping by now, but I'm grateful that you could take this very seriously to attend. Let me start. My communications person, the head of our communications unit, is actually on. I want to thank her for actually joining and being part of it. So she's called Beth. Beth is our head of public relation and communications office. So Beth, thank you for being on. One reminder before I answer the other ones, please, those numbers I've given you, there are people who are in a different time zone. Please, when you call and it is daytime in the US, here it is night, we are sleeping. So sometimes you get frustrated and you send us a lot of frustration because you say we are not picking. Please look at the time and make sure that you are calling during working hours, because those are desk phones. They are not mobile phones. They are desk phones. Please make sure that you are calling in during working hours. Now, the people who are tired of being allied health professionals, anyway, maybe it is possible, but for me, I don't know of anything else I would have been if I wasn't allied. And I am living it, I am living my life to the fullest. But if in the event that you are tired of being an allied health professional, write to us, suspend the license, because you never know, you could come back. I don't want you to be tired of allied health for 9 years and then one day circumstances push you back. Then I give you a bill of 1.4 for you to renew the license. But if you suspend, at the time you come back, you will pay 170,000 and you are ready to go. Finished. So you just write to us and we suspend your license or your practice. So number 2, what does it take to work at Allied Professions Council? Allied Professions Council is a government agency. So all the public service rules and regulations for recruitment fully apply. There is no job at Allied which will be filled without an advertisement. If you ever see that somebody was recruited without advert, please go to IGG. It is a crime. Public jobs must be competed for. And when you compete, there is a very elaborate process for interviewing and selecting the best candidate. Even me, by the way, I joined the council in September last year. I saw an advert, I think in March of 2025, and I applied. I was shortlisted, and I went through a series of interviews at the Health Service Commission, and I was appointed. So I didn't know anybody. Well, I knew the registrar because I had gone there because of Makerere. There was a program in Makerere called Biomedical Science and the Bachelor of Cytotechnology, which we wanted to Allied to register. So we would go in meetings and quarrel. In fact, I thought I would never get a job there because the registrar was so tired of me and my colleagues at Makerere for advocating for cytotechnologies to be registered. But thank God, when you are good, you are good. You go for the interview, you are the best, you are the best. They take you. So please, when you see the advert Allied Professions Council, you know it is going to be fair and square. The best candidate will win. We are still one of those agencies which are recruiting based on merit. There is no corner. So don't even try to buy anyone, because if you buy anyone and I know about it, I tell you for sure, I will cancel your application there and then. You will not succeed. Okay? For Gloria and the people who are frustrated about this registration, let me tell you, I am a parent. My firstborn child is in first year in a university. And to just make her reach there, I have paid a ton of money. Sometimes I told my wife, stop keeping those, they call them what? The bank slips, the payment statements. I stopped because it is a lot of money. It is a lot of money. Now that she's even in university now, I count the number of semesters left for her to come out. They feel like it is forever. And I cannot imagine that she will come out and somebody plays chicken games with their transcript. It is a very frustrating. I am as frustrated as these young professionals are, and Allied has made an initiative to talk to our colleagues to make sure that we actually try our level best to make a waiver. And this testimonial thing actually came because we pressed. And they also actually accepted. We thank them for actually accepting proposals, and we jointly made the decision that let's issue the the testimonial. And I don't even know whether we are breaking the law, because when we went to council, because everything that we do as registrars, there is a governing council of 16 people. We go and present that this is the idea we have. We want to register people using a testimonial and not a transcript. The first time they heard about it, they were like, you people, are you crazy? How are you going to do that? You're committing an offense. And we were like, no, the law does not exactly say that it is an offense. It says that we should register eligible people who have finished their courses of study. If there is an alternative way to verify, I think legally we should be able to register it. But we don't know for sure whether we are actually committing an offense or not. But we did it because we wanted to cure the frustration. And we are going to continue talking to our colleagues in the sister agents of UHPAB and actually continue to resolve even these issues which are of expired testimonials. I believe we will resolve it because it is in the best interest of both organizations, and most importantly, it is in the best interests of the professional who has graduated and should be able to go and practice. In fact, it is a danger to the community because we know these people don't have documents. We don't know whether they are passed, but they are treating people. We know they are there treating people. So we rather resolve this matter so that we regulate them. So thank you very much, and a very good night to all of you. Thank you.
Thank you so much, Dr. Bagaya. Bernard, for making time tonight. I want to thank all the people that have followed this particular episode of the Medical Professionals Roundtable. Thank you so much, Gloria, for always making time and for being here or with us. I understand that this session has not gone to waste, as a number of you have picked what you could. I also want to recognize the fact that, Doctor, there are so many requests that are coming through about several topics that people would like for you to talk about in the coming sessions. And whenever there is time, I will always reach out to you, and probably we plan accordingly. Other than that, the talk shows at Medical Info that make sense are sponsored by Midland High School. We also have sponsors, the MCare, which is an online pharmacy place that you can always go to. Thank you so much, people that are following us here. Dixon, I see you. Beth, thank you. You have been very active. Boss Lady, thank you so much for making time. Beloved, I see you. Ninja Wealth, Patrick, Joshua, I see Hudson here. I also see Jonathan. Thank you guys for making time. TBJ, thank you so very much. Home Base, Kenya, Nicole, I cannot mention all of you guys, but I want to thank you so much for always making time. Until next Friday, let us meet. The people that have missed some parts of this session, I know that Gloria is going to cut them out and he will share. Likewise, I'll do the same during the course of the week. Probably you will get refreshed during the course of the week. Thank you, Dr. Ronnie, Dr. 24 Hours Medical Center, Fred, Douglas. I cannot mention all of you, but I want you guys to feel thanked and recognized there. Thank you so much. Until next Friday.